Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha from Roots Community Health Center, and my guest today is Nurse Kee Konti, Director of Infusion Therapy at Total Infusion, and we are reporting for the week of August 16th, 2021. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we are here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Alameda County has now passed 100,000 COVID cases, up about 2,000 from last week. We now have 101,876 COVID-19 cases in the county, and there's also been an increase of 11 deaths, so we now have 1,302 people in Alameda County who have lost their lives to COVID-19. Regarding vaccination, we continue to creep up, and we have 86.6% of those 12 and up who've received at least one dose, and 73.1% who are fully vaccinated. Oakland is trailing a couple of points behind at 84.2% and 69.9% respectively. Keeping in mind that, of course, this does not include anyone under 12. This translates into about 62% of the county being fully vaccinated and just under 60% of Oakland being fully vaccinated. So clearly a ways away from anything we thought we might need for herd immunity. And when we look at positivity rates and we look at daily case rates, we can see that it looks like things are starting to come back down. So this is very hopeful. We certainly hope it's a trend that will continue. With regards to hospitalizations, unfortunately, we're exactly the same as we were last week at 221 people in the hospital with COVID-19. And when we look at positivity rates across the county, we can still see that the places with the highest positivity rates continue to be East Oakland with the 94603 and 94621 at about 11% positivity rate. And now we also have 94605 in West Oakland and 94607 in West Oakland that are at about 9% positivity rate. So these zip codes are all more than double the county average. Last Thursday, the FDA granted a regulatory amendment to the emergency use authorizations for the mRNA vaccines. And this was important because this is what's required in order for any clinical recommendation to come out that says to do anything differently than what was in the EUA. So these emergency use authorizations are rather strict in that you must adhere specifically to what's in the EUA unless there is an amendment. And as of this past Thursday, there is now an amendment, a regulatory allowance, and that allowed for the CDC and the Advisory Committee on Immunization Practices, ACIP, to then consider and make recommendations, which they did the following day, this past Friday. And so we have reviewed the ACIP's deliberation, and what they did was consider anyone who has moderate to severe immunocompromise. I'll go over what that is in just a moment. That is also 18 and up. It did not consider children. It did not consider those who received J&J, and it did not consider anyone who doesn't have a moderate to severe immunocompromising condition. And I'm going to talk a little bit more about that in detail in a moment. But first, I want to say that this is nothing surprising or new or unusual for people with immunocompromise. In fact, we see and expect that when we are giving anything that we expect to stimulate the immune system or ask the immune system to mount a response to something like a vaccine, that when people have a immune system that is compromised, that we can expect that they may not have the same response as someone whose immune system is not compromised. So there are even higher dose flu vaccines, for example, for people who are older or who might have immune compromise. And we've seen this with other vaccines as well. So this is something predicted. And it's also something that we began to see in the real world data, that people who were having breakthrough type of infections that were more serious, so that very small percent that are being hospitalized or dying, are primarily within this category of people who have immune compromise. And so what that really means is that most likely they did not mount an adequate response to their primary series of vaccine, and therefore what the ACIP was really looking at is, do immunocompromised people need a higher dose or more doses, etc. And up until now, we have been limited by the EUA, and so we're not able to do off-label uses like we can do when something is fully licensed. We have to stick with specifically what is in the emergency use authorization until we receive an amendment, which now has happened as of last week. But in the meantime, and where we did get a lot of the data to base these recommendations on, was from other countries that have already implemented policies around an additional dose for people with immune compromise. So looking at France, Israel, the UK, Germany, and even other countries that have done studies on giving additional doses. And so what we mean by additional doses, and there's just so much in the media about additional doses, booster doses, new vaccines. And so I just wanted to take a moment to clarify that the focus of this amendment is actually an additional dose after the primary vaccine series when we're concerned that the immune response was not sufficient against the primary series. For booster doses, what that refers to is a dose after the primary vaccine series when the immune response might have been just fine initially, but that has decreased over time. And we have not yet established that this is happening or that this is needed yet. And the other thing I'll just throw into the mix here is that as we start to get further out and talk about booster doses, we are also starting to think about doses that might be specific to some of the newer variants that we're seeing. So up until now, and the focus of this augmentation of the guidelines is really the first one here, an additional dose that is after the primary vaccine series when we're concerned that that immune response was not enough after the first primary series. And so this is specific to people with moderate or severe immunocompromise. And so who is that? And you can see that this list here I've taken specifically just right out of the ACIP slide deck, and you can find that on the CDC's website under the ACIP meeting materials. So here we are talking about people who are being treated for either a solid tumor or blood cancers, people who have received an organ transplant and they're now taking immunosuppressive therapy. We are talking about people who've had stem cell transplants and are taking immunosuppressive therapy. We're also talking about people who are born with a moderate or severe immunodeficiency like DeGeorge syndrome or Wiskott-Aldrich syndrome. We're also talking about advanced or untreated HIV, and those who are taking high-dose corticosteroids, which could be more than 20 milligrams of prednisone or something equivalent, as well as a whole list of other immunosuppressive treatments that you can see here on this last bullet point. I will also take this moment to say that this group does include those with sickle cell disease. Now, the ACIP recommendation is that anyone on that list, and if you're not sure if you're on that list, this is definitely a conversation to have with your primary care provider or your specialist. But anyone who fits into this category of moderate to severe immunocompromise and is 18 and up should receive a 3-dose mRNA series. And so what that means is that you should receive the same vaccine that you got with the first dose and the second dose. The third dose should be the same vaccine, and it should be at least 28 days after the second dose. So you get your first dose, and then depending if it's Pfizer or Moderna, you get the second dose in 3 or 4 weeks. And then that third dose is going to be 28 days or later after that second dose. And if for some reason you have immune compromise and haven't gotten any, then really what we're saying is you need this 3-dose series. And this is something to be determined along with your physician, but no proof of this is going to be required. But I will say that if you don't fall into this category, it is probably worth just waiting. And I'll tell you why, because there are a number of things that are in the works. I do want to make a note about Johnson & Johnson because we are getting so many questions about this. And of course, it is so reasonable and only fair because in particular, if you fall into this category of being moderately or severely immunocompromised, you naturally want to know, am I protected with J&J? And as far as I think what a lot of physicians and scientists are seeing and thinking is that the J&J in this case would be the primary series, and therefore if we think that immunocompromised people should get an additional dose after the primary series, then that is likely what most are going to want to recommend. However, and what the committee sort of alluded to is that J&J came out months after the mRNA vaccines. And so they need just a little bit more time to take a look at the data and give the best recommendation. And so I would say that this is one of those judgment calls that is going to probably be made in a discussion with you and your physician. If you are, incredibly careful, you're sheltering in place, you're not being exposed, then that is one consideration. But if you're worried that you're going out there, you're being exposed, you're immunocompromised, and you only receive the J&J, then that may be another consideration. But I would say that if we wait a bit longer, we may get more specific recommendations. Right now, we have none as it relates to what to do if what you got was the J&J. We don't have specific recommendations, and what may come out might be, get a particular brand. You should get an mRNA. No, you should get a J&J. And so, to the extent that they're able to gather up that kind of evidence, we'll just have more to go on when that time comes. But again, this is something that should be determined between you and your physician. But some of the upcoming studies that we have to look forward to here are that the NIH, as well as manufacturers, they are, of course, looking at all the data from those early trials, the early phases of the trials. They are looking at people's response, what it does over time. There are even studies going on that are looking at what they call a heterologous boost. And what that means is giving a different brand or a different vaccine from the ones that were received initially. The other thing that we know is happening, I don't have a ton of detail about it, but we do know that that at least Pfizer is working on variant specific boosters. So once again, there are a number of things in the works that if you don't fall into what is more of an urgent situation, meaning if you don't fall into that moderate to severe immunocompromise, where what we're really worried about here is that you did not mount enough of a response with the first two, and we want you to get a third, and we'll consider that being fully vaccinated for someone who is moderate to severe, at least for purposes of you being able to be reassured that you have the proper amount of protection. So that's really the group that we are most concerned about. What I think we also are hoping for is, first of all, that we get that full biologic license so that there can be more research and studies going on around all of these questions that we have about mixing and matching, or about what to do if you're in particular groups. So there will be more to come on that, but right now there just isn't enough evidence to support doing anything specific or any specific recommendation, especially for anyone who does not fall into these immunocompromised groups. And so I do not suggest just going out and running out to get a third dose because you can, because we want to get as much evidence and information as possible when right now we don't feel that you're in a vulnerable or serious situation. We still want everyone to be careful. And in fact, I'll take this moment to say that even when the mask mandates were lowered, all of us who are taking care of people who are immunocompromised were recommending that our patients continue to mask and be careful, because we're always concerned about potential variable responses to a vaccine, particularly for people with immune compromising conditions. So, just saying that to say that we all need to continue to be cautious. None of us actually knows exactly how big of a response that we mounted. The data is pretty compelling that with an intact immune system, that the 2 doses of the mRNA are enough and the 1 dose of the J&J are enough to protect you from severe illness and hospitalization. But as we know, we are still working with an evolving virus, an evolving pandemic, and so we'll need to continue to keep an eye on the new data and also on new recommendations. Now, the other thing that we are certainly hopeful for is that one day we'll actually have a test that can help us measure how good our immune response was. But right now, there is no such test that's commercially available. This is not an easy thing to measure because it is about a lot more than antibodies. So please don't be tempted to get an antibody test and base any interventions on that, because that is not, we just don't have enough information to know that that is going to be accurate. And because there's so many other ways that we mount an immune response. And so hopefully one day we'll have a great way to measure that and know exactly what needs to be done. So these are other things that we certainly hope are on the horizon to better guide what it is that we need to do. So right now, the clear recommendation is for people who fall into those moderate to severe immunocompromised groups and no one else. And we will be anxiously awaiting some guidance around J&J. And in the meantime, please do reach out to your physician to have that conversation. Now, in the meantime, I want to take this opportunity, as I've done many times on this briefing, to emphasize that we do have one outpatient treatment for COVID-19 that is being sorely underutilized, and it is very concerning, especially knowing that we are in a high-risk area and that we still have people contracting, being hospitalized, and dying from COVID-19. And this is a potentially life-saving treatment. Monoclonal antibodies basically act like your own antibodies, but it is really important that it be started quickly, because if we wait until you are sick enough to go to the hospital, it is actually too late for this treatment. And so we want you to be on alert, particularly if you're in a high-risk category. If you get any symptoms of COVID-19, whether or not you're vaccinated, please get tested and please ask about monoclonal antibodies, because they have to be started within 10 days and they have to be started before you're sick enough to go to the hospital, which we don't know because sometimes people's condition turns very quickly and takes us off guard, and we don't want that to happen. So as soon as you get those symptoms and as soon as you get that positive test, and now even as soon as you get exposed, we want you to be looking out for yourself and for your loved ones and advocating for yourself to get this treatment, because we know that we've heard many stories about people who've gotten tested, they've gone to the doctor, maybe they've gone to the ER and been told that there's nothing that can be done. And next thing you know, they're in the hospital and doing poorly. And this is something that we want to avoid. And so we think that not enough people just know that this treatment exists or know how to access it, but that is what we are here to tell you about today. And so this is a free treatment. It is an IV infusion. So you do have to be administered monoclonal antibody treatment by an IV. It's just about an hour. And this is something that is made in the lab. It doesn't use anybody's blood or any transfusion or anything like that. And it gives you temporary immunity. So it's basically giving you the antibodies that you might not make on your own, and we're giving it to you right at the right time, or we hope we can give it to you right at the right time. And so remember, the only way that you are going to have antibodies to this novel coronavirus, this SARS-CoV-2, the only way that you're going to have antibodies is if you've either contracted COVID before or if you've gotten the vaccine. And remember, we've just talked about a whole group of people who may have gotten the vaccine and not mounted a good enough response. So they may not also have antibodies. So if there's a chance that you might not have good antibodies, if you catch COVID-19 and you've got symptoms, now on the left, we're showing that someone who doesn't have any antibodies, there goes the SARS-CoV-2 attaching to the cell. And once that happens, that's when you start to get sick. And that's when things get really unpredictable. And some people have severe reactions. Some people have an overwhelming inflammatory response. in which they get into organ failure and all the things that we've heard about that can happen from COVID-19. On the right, all those little Y shapes, those are antibodies. So those could be your natural antibodies. Those could be the monoclonal antibodies. So if you don't have your own antibodies, and we can get this to you at the right time when the COVID is in there, but it hasn't attached to all your cells yet, that's that narrow window of time. So this is still a little tricky. That's why this is nothing compared to just getting the vaccine and actually having your army of antibodies on standby ready to go. But in the event that you don't have that, then this is our kind of last ditch effort before we just let things take their course and, hope for the best. And so in this case, this is an intervention that we're giving you those Y-shaped antibodies, and it clicks right onto that spike protein of the SARS-CoV-2, and it won't let the SARS-CoV-2 attach to your cells. And this is how it really stops the progression of COVID-19 and can keep you from getting very sick or having to go to the hospital. Now, who qualifies? And I borrowed this from the HHS website. And you can see that as long as you're 12 and up, there are a number of conditions that may qualify you for monoclonal antibody treatment. Now, anybody 65 and up is eligible. And anybody who is 12 and up and has obesity qualifies. And this is important because we don't hear about this enough, but we believe that the reason why those with obesity tend to do poorly with COVID-19 has something to do with being in more of a state of inflammation. And as I mentioned, when you catch COVID-19, some people have this very unpredictable, overwhelming inflammatory response that we don't quite understand, but we do know that poor outcomes are associated with obesity as well as diabetes. So if you have obesity, diabetes, chronic kidney disease, a host of heart conditions or lung conditions, and you're 12 and up, you qualify for monoclonal antibody treatment. If you are at high risk for any other reason, if you have sickle cell disease, if you're 18 and up and you are pregnant, if you are 55 and up and have high blood pressure, there are a number of qualifying factors for you to get monoclonal antibodies. So please do not assume that you're not eligible. Please know that you have a right to this treatment, and we are so very fortunate and blessed to have right here in East Oakland at Eastmont Mall an infusion center that is there for you and is able to provide you this potentially life-saving treatment regardless of if you have insurance or not, regardless of your residency status. And I'm pleased to have a special guest, Nurse Kee Konti, to tell you more. Nurse Konti?
Thank you, Dr. Abalata. Good morning, viewers. My name is Kee Konti. I am the Director of Infusion Therapy at Total Infusion. Total Infusion is a community-based outpatient infusion center located here in East Oakland at Eastmont Town Center. Total Infusion has joined Roots Community Health Center and other community organizations in the fight against COVID. As you're all aware, COVID has devastated our community. We continue to encourage everyone to please get vaccinated. If you do find yourself COVID positive or someone you love, treatment is available. Monoclonal antibodies are proteins that mimic the human immune system. They are administered intravenously. If you're COVID positive and you've had an onset of mild to moderate symptoms within the past 10 days, and you're at least 12 years of age and 88 pounds with a high-risk condition, you are eligible for treatment. High-risk conditions include heart disease, lung disease, kidney disease, diabetes, obesity, race, ethnicity, autoimmune disease conditions, cancer. If you're on cancer treatment, the physician has a clinical latitude to determine whether or not you meet eligibility criteria. Recently, the FDA also authorized this life-saving treatment for post-exposure prophylaxis. So if you live in the home with someone who is confirmed COVID positive, or you hug, kiss, share eating or drinking utensils, you too may be eligible for this treatment. Please contact your physician immediately as the window of opportunity is narrow, 10 days from the onset of symptoms. Referrals for treatment may be sent to Total Infusion at totalinfusion.com make-a-referral/. You can also call our clinic at 510-878-9528. Thank you, and back to you, Dr. Avalada.
Thank you for that, Nurse Konti. Remember, if you believed you're exposed to COVID-19 and you have not been vaccinated, isolate yourself, get tested in 3 to 5 days, and continue to isolate until you get your results. If you get COVID symptoms, get tested right away, even if you're fully vaccinated, and isolate until you get your results. If you test positive, please reach out to your close contacts, ask them to get tested and to isolate as well. If you test positive, please inquire about monoclonal antibody treatment. And please tell people that you know. Get the word out that this treatment exists. We have a right to this treatment. It is free, it is available, and it is being underutilized, and it could save your life. To optimize your immune functioning, consider taking a multivitamin supplement, consider additional vitamin D supplementation. Manage your stress and get a good night's sleep. That concludes today's People's Health Briefing. Thank you for joining us. Please tune in next Tuesday at 10 a.m. See you then.